Good morning, everybody, and welcome to this virtual celebration of the 40th annual Jennifer Brager Memorial Awards for completed, ongoing, and new cancer research or clinical projects. And as always, I'd like to acknowledge the ongoing generosity of Dodie and Tommy Brager, who are here in our Hollywood Squares collection of wonderful faces to see this morning. They have supported this for 4 decades. They founded the awards in loving memory of their daughter, Jennifer, hoping to improve and humanize the care of everyone affected by cancer and their families. And we are honored to continue to uphold this legacy every year. As many of you know, the Brager Awards are celebrating their 40th anniversary this year. And coincidentally enough, the Campbell Cancer Center is celebrating a very significant milestone of its own, its 50th anniversary of being formally designated as a department and a cancer center, becoming a beacon for cancer care in this community, the state of Maryland, and in the region. And what's amazing to think about is in the last 50 years and the last 40 years, just how much things have changed. And it's had a significant impact of nursing and other health professionals. Actually, an interesting historical point as we've looked back. In 1973, this cancer center was launched formally. There had been cancer care and cancer programs that preceded that, but the formal cancer center was launched at that time. In the same year, 20 oncology nurses got together. First time they formally brought themselves together to think about the future and thought, well, you know, cancer care is going to get better and better and better. There's going to be many innovations. Nursing for cancer care is going to have to get better and better. And by the way, social work, all these types of things are going to have to get better and better. And the upshot of these 20 nurses getting together is they launched the Oncology Nursing Society, which was started 2 years later. And that's a venue by which oncology nurses, especially including our own, present research findings and the like. And it's not unusual at all to have some of the research conducted here, supported by the Jennifer Brager Memorial Awards, be presented at the Oncology Nursing Society annual meetings. And we are among the most innovative nurses and allied health professionals, you know, pretty much anywhere. So if you look back and say what's been accomplished, in 1977, there was a new cancer center building. It's hard to think of it that way since it's already been knocked down and replaced with something else. Having said that, if you looked at cancer care in that building, the most modern we could come up with, to receive an infusion of chemotherapy as an outpatient, you received it in a room that was a little bit darkened. That was helpful. It was the room where Band-Aids and IV tubing was stored. There were 8 sort of chaise lounge chairs in a circle, and people were hooked up to IVs, provided with a bucket because they inevitably would vomit, and we did not control that very well in those days. And that was what we thought of as ambulatory cancer care. It's amazing just to think about how different it is now. Most cancer care is in the ambulatory setting these days, and they're in wonderful kinds of facilities with significant privacy in places that we see, like in the Vera and the Weinberg building. The treatments are entirely different. Rather than, you know, assaulting hair, we still do this a little bit, but rather than assaulting hair, dropping blood counts and the like, we now have a whole set of treatments with different side effect risks, but they are getting better and better and better. And many of you know, when I was still providing medical oncology care, I was fundamentally a genitourinary oncologist, a prostate cancer doctor, and was encouraged by one of the foundations to look back at prostate cancer treatment. The worst year for cancer mortality in the United States was 1991 for age adjusted. That's the propensity for someone to die of a cancer at any age. And it's only gotten better since that time. It's gone down almost by a third. Many people think there's as many as 3 million lives saved since 1991. But the statistic that sits in my brain is at this point, the 5-year survival for a man diagnosed with prostate cancer in the United States is 99%. That's a remarkable statistic. And the reason it's remarkable is the 5-year survival for men who do not have any diagnosis of cancer at the same age is not as good as that. So men with prostate cancer have a better 5-year survival than men who don't have the disease. That's just astonishing to me. There's some interesting reasons why that's true, but it's still an amazing feat. So we've come a long way, and that long way has been accomplished by innovations in cancer science, innovations in cancer treatment and medical oncology, as well as innovations by nurses, social workers, and all the allied health professionals who have gotten together to improve the experience and the future for everyone with cancer. So Dodie and Tommy, we're deeply thankful to you for honoring Jennifer's memory in such a meaningful way and for your very active involvement each year. Unfortunately, we're not here personally, and I have a feeling that's the reason that we don't see flowers blooming and birds chirping out the window. That was always the first rite of spring when Dodie and Tommy would join us. But your support has played a vital role in ensuring the progress that we just discussed. And you have never lost sight that there's a person in the middle of this experience, the patients and their families, and they're the most important people to chase after. And I'd like to send a warm welcome to your family and friends who've been able to join us today. And the good news is they can join us perhaps a little bit more easily virtually, but I'm sorry that we can't all be here together. So these unique awards we're going to hear a little bit about today encourage continued cancer research by allied health professionals across the Campbell Cancer Center, providing support and encouragement to investigators who otherwise have very little in the way of resources to underwrite the research that focuses on the care and healing aspects of the cancer experience. And so first thing I want to do is acknowledge everyone who submitted proposals this year that were not selected. There were a total of 8 research submissions this year. That's a really good year for us. And I hope, of course, that each of these people figure out a way to get some of their research done and come back with submissions next year. And we have a top flight evaluation committee, the Brager Awards Committee, with Sandra Bailey, Jayshree Blakely, Rhonda Cooper, Pam Frankenfield, Michael Hibbler, Sarah Holine, Don List, Allison Rich, Lee Sensinger, and Jeanette Almonte. And of course, they're joined in this process by Mrs. Brager, who's had a significant tenure on this committee, getting to see all the research proposals and helping with some of the selection. So now it's time to acknowledge and present this year's research awards. Yes, that was a plural. We have actually selected 2 for this 40th anniversary. And the first award will go to Jack Parker, the Research Program Coordinator in Developmental Therapeutics. And the title of his research is Can Therapy Dogs Reduce Anxiety in Patients with Cancer? Congratulations, Jack. Normally you would hear a thunderous applause and we'd be handing you a certificate and taking photographs, etc. I know everyone on this virtual experience is cheering for you, and everyone in the Cancer Center is rooting for you, and we will be delivering you a certificate very soon. Jack, let me turn it over to you to share a few words.
Yeah, so thank you so much for selecting my research proposal. I'm very excited to implement a therapy dog program for patients with cancer on infusion days. I know just how powerful a dog can be for stabilizing and improving mood. And I think that is a very important aspect of oncology care. So I'm very excited to implement a research program to hopefully quantify the effects of therapy dogs on infusion days. But the other big thing I wanted to do is just set up a program for those in outpatient services to have therapy dogs. So thank you.
Thank you, Jack. Again, thunderous applause. It should be deafening in your ear, I would hope. The second of this year's award goes to the team of Yanka Campbell, who I can see right in front of me here, and Jasmine Reed. They are the quality improvement team leaders and the data safety coordinator, respectively. And the title of their research is going to be Preventing Goal Discordant Care, Improving Documentation of Advanced Directives for Patients with Cancer. And congratulations, Yanka and Jasmine. Again, you both will be receiving framed certificates soon, and we are looking forward to what you will accomplish in the next year. And let me turn it over to both of you for a few words. Yanka?
Oh, thank you so much. Thank you for considering our quality improvement proposal and awarding us this opportunity to continue to just advance the work that we have been able to do collaborative with a multidisciplinary team to improve discussions about goals of care for our patients, to capture our patient wishes so that we make sure that we provide cares that are in accordance with their values and wishes when that time comes. So thank you so much. This is something that is a strategic priority for the entire Cancer Center, and we could not be more grateful for this support to continue to expand that work. But I would just like to take a moment to really tell some of our key work group members, thank you. This work could not have been done without the support of our Vice Chair of Quality, Dr. Alan Chen, and of course, our amazing PFACT member, Margaret Brennan, who has been by our side through this entire process, our social work team, our admitting team, our case managers, our chaplain. So thank you, everyone, and we look forward to just continuing this work to improve care for our patients moving forward. Jasmine?
I just like to echo Yanka's sentiments. We wouldn't be here without everyone in the work group. So thank you, everyone.
Well, thank you, Yanka and Jasmine, and congratulations. And along with Jack, we expect to hear great things next year, hopefully in person. You can tell us how things worked out, and it'll be great to see how this progresses. At this time, I would like to invite Allison Rich and Sarah Holine to the podium, the virtual podium, I guess, to present the Brager Humanitarian Award. Allison, I see you there.
Yes, thank you, Dr. Nelson. As always, it's an honor for Sarah and I to be presenting the Humanitarian Award, and especially so this year in recognition of the 40th anniversary of the Brager Awards. So to kick us off, I wanted to start by saying I know that we are all pretty fatigued by hearing words like unprecedented after the last few years, but the reality is that there is no better term to describe the unique and continued challenges that our faculty and staff continue to face across the Kimmel team. And what is really most striking to us, especially so as we reviewed this year's nominations, is the fact that despite this inevitable fatigue, the members of our community continue to rise not only to the logistical challenges which we continue to be confronted with, but they continue to do so in a way that never loses the sight of the person in each of our patients. And while the current climate has raised untold numbers of anxieties for all of us, this is amplified even more so by folks who are in the midst of an active cancer journey. But in spite of all of this, the Brager Humanitarian Award really stands in recognition of the continued endurance, empathy, and truly the humanity of our staff here at the Kimmel Cancer Center. Nominated by multiple patients whose cancer journey was improved upon by their care, this year's nominee was recognized as having truly gone above and beyond the scope of duty, embodying traits like compassion, consistency, honesty, sensitivity, and hope in the moments when it matters most. So with that in mind, it is my pleasure to recognize our recipient, Mr. Andre Harry, who serves as patient registrar for oncology ambulatory services over at the Kimmel Cancer Center at Bayview. I'd like to take this moment to read you all a few excerpts from the patient nominations, and there were several that were shared for Andre this year. One nominating patient shared, "Andre is a lifesaver when it comes to making sure everything is up to date. And I would think the most important thing is the fact that he acknowledges us and everyone else that walks into the waiting area. He says hello, he asks about us, and is so genuine that for as bad as it could be, he puts a smile on our face every time we walk in there." Another patient stated, "There is a jewel in your midst and it may not be known. Andre has been consistently pleasant and has treated me with the utmost respect. Although I am coming for immunotherapy, his greetings make me feel that everything is going to be all right, and there's really no reason to be overly concerned. He puts you at ease. Andre is soft-spoken, kind, and efficient. When he talks to you, there is always eye contact, and he asks what I need. He doesn't put you off or make you feel as if you are an intrusion to his day. His focus is truly at the job at hand. And last but certainly not least, another patient shared, I just adore Andre's kindness and his attitude. I was glad he was there to greet me every day. It definitely makes the difficult days easier. Positive attitude and kindness go such a long way. Truly incredible words, Andre, and we are so pleased to present you with this award this year and to recognize the ways in which you embody the very essence of community that we so value here at the Kimmel Cancer Center. Thank you for all that you do, and I know that you might want to share a few words with us, so I'm going to hand it over to you in this moment.
Morning, everybody. Thank you so much for this award. When I was told that I was the recipient of the Jennifer L. Brager Humanitarian Award, I felt extremely honored, excited, and proud. I actually didn't know that this award existed. When I realized that it was because of the kind words from patients and their caregivers, it made the award that much more special. It shows that people genuinely notice acts of kindness and how important it is to be kind to one another. My parents always taught me to be kind to people. My dad would always say that it doesn't cost anything to be nice to people. You might just make someone's day and change their outlook on things. My mom would always say that if you have the ability to make someone smile, do it. She would tell me that with a little more love, a little more kindness, and a little more patience, the world would be a much better place. And I try to show those characteristics every day. When I lost my mom a few years ago, I didn't know if I would continue to display those characteristics because losing her felt so unfair. But I also knew that as long as I'm here, I'm representing her and her legacy of showing love and kindness to everyone who I cross paths with. To show love and respect to everyone, no matter what walk of life they come from, and treat the janitor just as well as you would treat the CEO. Always want to continue to make her and my dad proud. Coincidentally, my start date at Bayview was on the anniversary of my mom's passing. I honestly didn't want to start that day, but I felt like that was God's way of telling me to continue to make my mom proud. Working at the cancer center, I found that being kind and compassionate and smiling, even behind a mask, really makes a big difference to our patients. It could be the difference between a patient wanting to keep receiving treatment and continuing to fight or just giving up. I've met so many special people who have come through our doors, and my goal is to show them that they're not just a name on our schedule. They are important to us. My coworkers and myself have formed so many special bonds with so many patients. On my first day, as she was training me, my friend and coworker, Lindsay, said to me, our patients have cancer, but cancer is not their life. And I knew exactly what she meant by that. I have so many people to thank for this honor today. Thank you to Judy Bekowitz and Jillian Polito for taking a chance on me when I had no healthcare experience. When I would get discouraged, they always lifted me up. Jillian once told me I was being hard on myself when I was getting discouraged because I wasn't picking up things as fast as I figured out I should. But she would say, you'll pick this up in due time. And what you bring to the table is something that can't be taught. Your compassion, empathy, and kindness can't be taught. That helped me to be patient with myself when everything started, and then everything started to sink in. Thank you to my coworkers and friends, Lindsay, Ashley, Adrian, DeMonte, Miss Mary, Ajane, Shatira, Alicia, Jen, and so many more who have been so nice and patient with me. To all of the doctors and nurses, Dr. Kristen Marone, Trisha Patel, Patrick Ford, Sarah Sigorsky, Valerie Peterson, Dr. Hahn, Dr. Murray, Dr. Gray, Dr. Feliciano, Michelle Turner. I'm sorry if I missed anyone, charge it to my head, not my heart. Thank you to all of the patients who took the time to send emails and calls to speak of positive interactions with me. Thank you to my friend of 20 years, John James, who keeps pushing me when I get discouraged. Thank you to my friend Tommy Dukes for always being there to support. Thank you to all of my siblings, and be patient. It's a lot of them. My brothers, Glenn, Nelson, Antonio, Miguel, Maurice, and Mark, and my sisters, Leslie, Mia, Tisha, and Shannon, for always motivating and supporting me. To my good friend, Warren Webster, who through his organization gave me the opportunity to spread love by feeding the homeless and providing them with clothing as well. And of course, to my cousin Troy, who's always been one of my biggest supporters growing up. A very special thank you to my dad for always being there when I need him, and even if it's just an ear to listen. And last but certainly not least, I want to thank my Aunt Betty for always being one of my biggest cheerleaders. From our haircut appointments to watching The Masked Singer and trying to figure out who's behind the mask and watching Judge Judy, she's always there for me. And I thank you so much, everyone. I feel so honored and proud to be the recipient of this prestigious award. And one quote that my mom and my grandfather, Willie Harry, would always say to me is a quote by Maya Angelou, that people will forget what you said, people will forget what you did, but they will never forget how you make them feel. Thank you.
Thank you so much, Andre. That was so lovely. It's such an honor for us to be able to extend this award to you today. And on that note, I'm going to hand it over to Sarah, who's going to share a little bit about the history of the Brager Awards. And I also want to add that all of our recipients in the coming days will be receiving a framed certificate in recognition of their receipt of this year's award. All right, Sarah, over to you.
Yeah, thank you. And congratulations again, Andre. As you were talking, and when you have a moment, you'll have to look at the chat for the Zoom call. Many of your colleagues are chiming in and congratulating you. And I wanted to share that as we were announcing your honor, colleagues were all coming forward and sharing that it was so well deserved. So you are not only touching patients and families, but also making an impact on your colleagues. So congratulations again. So just as each of today's recipients are very special, this day continues to be a special moment here in the Cancer Center. We are very thankful for the Bragers' ongoing support. And as a little bit of background, Mr. and Mrs. Brager established the Humanitarian Award to give patients and their families a formal way to recognize non-physician Kimmel Cancer Center staff who have given superb humanitarian care, who have gone above and beyond in their job to give more time, attention, care, and comfort. And as we all have heard, Andre does that on a daily basis. Throughout the year, patients and families can submit a nomination through our online form in the Kimmel Cancer Center. It's on our Kimmel website, and there's a link there for it. Also by sending an email to bragerawards@jhmi.edu, or by a paper form located at various submission boxes throughout the Cancer Center. In addition, when managers, faculty, for those of you on the call, for anyone that receives grateful letters written by patients and families, which acknowledge the care of an individual staff member, those letters and emails can also be forwarded to the committee at our email address here as a submission for the Humanitarian Award as well. And submissions are on a rolling basis, so we always welcome hearing from you. The next issue of Centerwide, we will be listing all the staff members who were nominated. So please take a moment to recognize and congratulate your fellow colleagues. And with that, just congratulations again to all of our Research and Humanitarian Award recipients today. We are so honored and proud to be working alongside you. And we'll turn it back over to Dr. Nelson.
Yeah, thanks, Sarah and Allison, and thanks, Andre in particular, for reminding us that it takes more than a mask to get in the way of a smile. And I think that's something we can carry for the rest of our lives, certainly through. Now it's time to hear a brief presentation from the Research Award winner from last year, who was Brett Myers, a physician assistant in gynecologic oncology. And the title of the research that we're going to hear about is Establishing a Pillbox Pharmacy for Oncology Patients. And unfortunately, due to an urgent scheduling conflict, Brett is unable to be here with us live virtually live, whatever we want to call it today. But one benefit of this format is that we were able to get her findings pre-recorded so they can be delivered with us. And she can be contacted by email or something if questions pop up about the presentation and whatnot. So.
Good morning. My name is Brett Myers, and I'm a physician assistant from the Gynecologic Oncology Department. For the last year, I've been working on a project entitled Establishing a Pillbox Pharmacy for Oncology Patients. I wanted to start off today by expressing my gratitude towards the Brager family for their support of my project and those of other advanced practice providers. I don't have any financial disclosures, but I did want to briefly touch on just two quick items. The first is the use of the word non-adherent, which you will hear me use often. I recognize that this term is a little offensive to patients and that we as medical providers typically try not to use it to label patients. However, it is defined by the World Health Organization and I think appropriate in this setting. Second, I would like to recognize and apologize for not being able to give this presentation live due to a scheduling conflict, but I wanted to provide my email address up front and encourage viewers to go ahead, open up an email, address it to me, and then just type any questions or comments you may have into the body and send it to me afterwards. And I'll respond to you as soon as I can. My motivation for this project was born out of the number of readmissions that I saw that could have been prevented if medications were taken as prescribed. I wanted to find a way to help our patients spend more time at home and not hospitalized due to medication adherence issues. Prior to applying for the award last year, I conducted a literature review to find out if these issues were experienced by other groups of people with cancer or chronic diseases, why this is a problem, and what has successfully been done about it. The answer to the first question is overwhelmingly yes. Patients with cancer and other chronic diseases, regardless of any other demographic or characteristics, experience problems with poor medication adherence. There's many reasons that this occurs, but a common source is polypharmacy. On the upcoming slides, I'll delve into some successful interventions, but I just wanted to highlight here some facts that I discovered. So the previous slide does paint a bit of a grim picture, but on the bright side, our patients are not alone in their struggles with medications. And there have been some research which have led to some evidence-based practices that have improved medication adherence. One easy to implement and effective strategy is the use of pillbox pharmacies. There's many definitions of pillbox pharmacies, but in simplest terms, it's a service that dispenses medications in organized containers of some sort. I have two examples here on this slide. The one on the left is actually a picture of the pillbox that I distributed to patients. And the picture on the right is a pill packet that you can have an online pharmacy make for you. I don't want to advertise for them, but they are a very large online company that has everything from A to Z. Pillbox pharmacies are considered a behavioral intervention. They encourage patients to self-assess and ultimately gain independence. These behavioral interventions are typically more successful than interventions that attempt to change beliefs, in this case, causing a patient to believe they're non-adherent and then feel they need to change based on that. Pillbox pharmacies are so effective that one study found that they can increase medication adherence to almost perfect levels. The efficacy of a pillbox pharmacy can be increased if it's combined with patient education, counseling, and assessment of unnecessary prescriptions. In simplest terms, I wanted to get pillboxes in the hands of our patients and collect a bit of data along the way so that I can track how I'm doing and how successful we are. So in a broader sense, oncology patients would be offered participation in this program if they were admitted to the hospital and prescribed 4 more medications. Providers could also refer patients that they thought could benefit from pillbox pharmacy services. All participants were given a pillbox for them to keep, a medication list to complete and hold on to, and education regarding how to use the pillbox, the importance of medication adherence, and some tips and tricks for how to improve medication adherence. The participants were then given an adherence to refills and medication survey. This is a 12-item questionnaire developed by Kripalani, Risser, Gotti, and Jacobson to evaluate self-reported adherence to taking and refilling medications among patients with chronic diseases. If patient scores on the arms differed from the established mean by 1 standard deviation or more, they would be offered Pillbox Pharmacy services. If they chose to utilize these services, then the patient would meet with me in person or via telehealth to fill their pillbox and learn some more about the program. I know this slide is a bit busy, but I at least wanted to show what the adherence to refills and medication scale, which I'll refer to as the ARMS, looks like. The questionnaire itself has a high internal consistency among patients of all literacy levels and has shown validity and reliability in several uses. Each question is answered using a Likert scale, which I didn't show just because of space, but the responses are all of the time, most of the time, some of the time, or none of the time. 1/3 of these questions measure the ability to refill medications appropriately, while 2/3 of the questions measure the ability to self-administer prescriptions. Each response is coded into a quantitative value 1 through 4 based on the Likert scale. And the overall ARMS score is the sum of all 12 responses, with lower scores representing better adherence. So just wanted to touch on some of the characteristics of participants. So they ranged in age from 26 to 77 with a median age of 58. All participants self-identified as female, and patients who participated identified as white or Caucasian, non-Hispanic Latinx, Black or African American, Asian, or other. I didn't have any participants who self-identified as white or Caucasian, Hispanic Latinx, American Indian or Alaskan Native, or Pacific Islander, Native Hawaiian. Employment status was pretty evenly split, with 46% of patients being employed and 54% being unemployed, including retired. As you can see, most patients who participated were married or in a domestic partnership. And just some additional demographics and participant data. So most of the patients had private insurance or Medicaid. I didn't have any participants who had TRICARE. 92% of patients had prescription coverage through their insurance or with a Medicare supplemental plan. The majority of the patients were diagnosed with ovarian cancer, and cancer stage was fairly evenly dispersed. Only 11.5% of participants were prescribed an oral chemotherapy. So at the beginning of this project, we defined non-adherent patients as those who scored on the ARMS questionnaire were 1 standard deviation or more away from the established mean score, according to previous studies performed in similar populations. So the big number here, we found that more than 1/4 of patients who participated in the project meet this criteria. And 3.8% of patients were more than 2 standard deviations away from the mean score. As I said, I wanted to do some data analysis from what I collected, and I started with some comparison between the patients who were adherent and those who were non-adherent. So I used the Mann-Whitney U test to determine if I was truly identifying 2 different groups. And based on that test, with a 95% confidence, I can reject the null hypothesis and see that we are seeing 2 different groups. My next big question is, why did this occur? If I find out why there's a difference, there's a chance that I can do something about it. Unfortunately, I performed regression analysis using all the demographic data that I just presented, and I didn't find a variable that impacts the ARMS scores. A final analysis that I added to this project was just a simple measure of feasibility. I wanted to prove that screening for medication adherence and intervening on non-adherence can be really easy for clinicians to add to their regular practice. Unfortunately, I didn't prove full feasibility, which we had defined as 90% of participants completing the ARMS or greater than 80% completing a Pillbox Pharmacy appointment. So all but 1 patient who agreed to participate did complete the ARMS. However, I had greater than 10% of patients decline to participate in the program. And I did not have 80% of patients complete a Pillbox Pharmacy appointment. Looking back, I've identified what I think are the biggest limitations thus far in the project. So the first is that overall I had less participation than I had anticipated. Close to a third of patients declined to participate. And in addition to distributing more pillboxes and educational materials, I'd like more patients to participate so that there's more of a chance to impact medication adherence. The second limitation that I noticed is that my data is queried from Epic. And although we all love our EMR, the data that I obtain is only as good as the data that's fed into it. So if any patients' self-identified demographics are entered incorrectly or they change and are not updated, my data won't know about it. Also, all of the data that I obtained about medications and refills is from the PDMP and CRISP. And so if that system has any errors in it, then my data would also be skewed. Finally, I wasn't quite able to complete all of the analysis that I would have wanted because I did not have any patients complete a Pillbox Pharmacy appointment. Even my patients who qualified for that service declined to make an appointment with me. So I also wanted to use this time putting this presentation together as a chance to sort of stop and reflect on the last year of work and figure out where to go from here based on where I've been. The first big lesson that I learned is just the amount of coordination and planning that it takes to get any sort of intervention or research project off the ground. I wanted to start working the day after this ceremony last year, but unfortunately I had to attain some IRB approval, which was quite an undertaking, and meet with different groups and gain approval from people. And I think this resulted in a more robust project overall, but it did take a fair amount of time. The second big lesson I learned is that patients don't necessarily want to consent for a research project, as simple as they may be, while recovering from a surgery or admitted to the hospital for medical reasons. As I've mentioned, I did collect data along the way, and so I do have a fairly thick consent form that with IRB approval. And I think that that might have been a bit overwhelming for patients or even a bit intimidating. And so I think that resulted in less participation. The third lesson, so to speak, that I learned is just how much patients want to speak to other people while they're in the hospital. And when I was able to meet with them, not as a clinician rounding or giving them the latest test results or order update, I found that I was really able to sit down with patients and take the time and get to know them and gain a better understanding. And it seemed to be that a lot of patients respected that and wanted to chat with me. So the future directions for this project, my overall goal is just to keep going forward. I'd like to think of this as an update and not a conclusion. There's still plenty of patients that are being prescribed many medications, and unfortunately, a lot of errors can come of that. I'd like to continue providing support for our patients and keep distributing pillboxes. Hopefully, I'll find a variable that impacts ARM scores so that I can try to work on it. And I may delve a little bit more into some health theories to figure out how to get people more adherent. I'd also like to scale the project up and involve more people. To reach more patients, I think it would be appropriate to involve my colleagues in other departments or taking care of other patients. In a perfect world, every provider would fulfill the NCCN's recommendation to perform medication screening for polypharmacy. I'd also love to partner with our wonderful oncology pharmacists. This was initially part of my plan. However, due to some staffing shortages over the last year, I was never able to do so. I would also like to potentially scale up using additional sources of funding, like the APP Opportunity Award or my department's internal grant with the Allegheny Health System. One idea that I kind of thought of along the way that I'm still developing is for patients to be given a phone call after meeting with me or the team to learn why they may have declined participation in the project or declined participation in Pillbox Pharmacy services. I think this would provide some valuable insight and potentially increase participation and usage. Finally, I would like to expand participation requirements and be able to ask all patients, whether admitted or just on observation, benign or malignant, and regardless of the amount of medications prescribed. Thank you again to the Brager family for their generous award and support. Thank you to my supervising physician, Dr. Stephanie Wethington, for her guidance. Thank you to Dr. Anna Beavis for her help with the initial grant application. And thanks to the rest of the Kelly Gynecologic Oncology team for their support. Last but not least, I want to thank our patients for granting me their time and allowing me to work on this project. I want to also thank you all for listening. Here's my email address again, in case you all have any questions or comments that you'd like to send my way. I'll respond to that as soon as I can. Here's just some of the sources that I used during my literature review and touched on here. And that's all I have. Thank you.
Thank you, Brett. And as the Jennifer Brager Memorial Awards progress into the 5th decade of providing a unique forum for investigators to share their research and insights and how they may improve the quality of life for cancer patients and their family, the quality of their care experience here at the Campbell Cancer Center. I'd like to take this opportunity to extend special gratitude to Mr. and Mrs. Brager for their ongoing support of these awards in Jennifer's memory and for their encouragement to have us do even better as we move forward. I know that they would like to take this moment to share a few words with us, and let me turn it over to you, Dodie and Tommy.
Good morning, everybody. It's hard to believe that we have completed 40 years of this, and we are so grateful that it's happened the way it's happened. Our goal after Jennifer died, we wanted a memorial to her that would be a living memorial. And this certainly has embodied everything that we had hoped it would. I congratulate Brett on her hard work and wish her good luck in the time to come. We are very happy for Jack and his therapy dog research, and we have a golden lab living upstairs right above us, so we know, look like that's what he was going to be using. And of course, I am think the advanced directive and planning for everyone, most especially patients who are ill, is so important. So I wish Yanka and Jasmine good luck on their research. I just want to say, because we have completed 40 years, we've done it beginning with the help of the directors of the Cancer Center, Dr. Albert Owens, Dr. Martin Abeloff, and of course currently with Dr. Bill Nelson. We're pleased that when he first arrived at the Cancer Center, our award ceremony was his first public appearance. And he has continued to be very supportive and involved. And in addition to that, I would like to have Tommy say a few words about a few other people who have helped us so much along the way. Before he does that, though, I would like to mention in the beginning of this, Michael Escalzo and Jim Zavora, who were really helped build the foundation of this award, and including Dr. Bridget Leventhal early on. So anyway, Tommy, it's up to you.
I just want to thank all the people that you've seen on your screen. Dr. Nelson, of course, Michael Hibbler, Sarah Holine, and Allison Rich, who do all the work, and we just listen in, whether it's in person or on the screen, because as I say, they do all the work, and we have the pleasure of seeing them and having them do all the work. Many thanks to each of you. And we hope to continue this for many months and years to come.
And one more thing I meant to say, Andre, that was such a beautiful talk. You certainly embody the lessons that were taught to you by your family. And I think the people with whom you meet over at Bayview are so lucky to have you there. And we were really so pleased to be able to grant you this award. Keep on doing what you're doing and sharing your philosophy with all the people around you. Thank you.
As usual, my wife speaks far better than I do, and I just double everything she says.
Well, thanks, Dodie and Tommy. And you just struck in my mind. We've been thinking a lot about the origins of the things that we do. 40 years of this Memorial Award ceremony, 50 years of the Cancer Center. And you mentioned Jim Zabora, Matt Lascalzo, Linda Arendt, who was the head of nursing at the time this started, taking a time to pause and think back on how these people launched us in the right direction. And certainly this Memorial Award ceremony has launched us in the right direction, and we're going to keep chasing after it in the most wonderful of ways, as you've heard today. So thank you, everybody, for joining us today in this virtual awards ceremony and presentations. And next spring, after we get through holidays, snow, sleet, we didn't have any snow this year, but snow, sleet, and whatnot, when the flowers start to bloom, you know where we'll be. We'll be right here with the Bragers and the Humanitarian Award and the Research Award ceremony. So thank you all very much.